Zoological Society है Vice Chancellor.
Inshallah. Welcome Professor Umar from very long time. दरमियान में डॉक्टर उमर रेगुलर थे, फिर बाद में डॉक्टर उमर जो है ना मेरे ख्याल है। डॉक्टर उमर क्या हाल है आपका?
अल्हम्दुलिल्लाह फर्स्ट क्लास जनाब, आप खैरियत से? मुलाजिम भाई
आप नेक आदमी हैं, दुआ करें। ये जो झटके रात के 11 बजे भी लोग उठ के झटके देना शुरू कर देते हैं, 11:30 बजे, और ये जो आप झटके हैं अल्लाह बंद करे, मुल्क को सलामत रखे।
आमीन सुम्मा आमीन अल्लाहुम्मा आमीन।
और मेरे दोस्त ठीक हैं आपके मुल्तान वाले? आमिर
Rashid, please unmute yourself.
आवाज
जी आ रही है?
जी आ रही आवाज, आ रही।
right. Is it echo? I think. Is it clear now? I think there's no echo now.
राशिद, आप 2 अकाउंट से लॉगिन हैं, एक को बंद कर दें, एक से चलें, फिर इको नहीं आएगी।
I think Professor Rashid, you are on mute or you have opened two.
Yes. Okay, it's done now. I think. Is it clear?
You're clear
it's fine now. It is fine now.
Yes. Oh, yes. I had logged in from 2 devices due to earthquake. I ran out of the room and I immediately logged in from another device. So I am back in the room. We start as directed by the Professor Mulazim. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا أيها الذين آمنوا إذا قمتم إلى الصلاة فاغسلوا وجوهكم وأيديكم إلى المرافق وامسحوا برؤوسكم وأرجلكم إلى الكعبين وإن كنتم جنبا فاطهروا صدق الله العظيم. This is a verse from Holy Quran, Surah Al-Ma'idah, verse number 66. This tells O you who have believed, when you rise to perform prayer, wash your faces and your forearms to your elbows, and wipe over your heads and wash your feet to the ankles, and take a clean bath. So this tells the importance of cleaning in Islam. Sadaqallahu
alazim. Thank you very much. Professor Salma Kondi, can you introduce today's speaker, Professor Javed Sarwar?
Ji. Professor Dr. Javed Sarwar is a renowned physician of Hazara. He is Professor of Medicine in Women Medical and Dental College, and at the moment he works in the DHQ, which was the former teaching hospital of AU Medical College, and nowadays we have taken it from the government on PPP basis. Dr. Javed Sarwar is a supervisor of CPSP, and he's got many trainees under his supervision, and he is going to teach us today. He is going to talk on this webinar about monkeypox. I hand this over to Dr. Javed Sarwar.
Thank you very much for giving me the opportunity in this webinar on the platform of Pakistan Medical Association. Really, it's a great honor for me to present this webinar. And the topic for today is, as you know, is the monkeypox. And monkeypox, you know, is a disease very new for us, especially the health professionals, although it has been in Africa, Western and Central Africa For last many years, it has been endemic in those countries. But after 2000, when there is an episode of cases reported in America, when there were cases reported in America in 2003, about 81 cases were reported in America in 2003. And then it created an alert throughout the countries that there's a disease which is spreading just like a smallpox. And then the awareness started. But the panic created in the world when in 2021, there were many cases reported outside the Africa, and last year also there were many cases reported. And that's why it's very important to know about the monkeypox. And in this today's webinar, I will try my best to present as much as regarding the information which is available to us regarding the monkeypox. As you know, the disease is new. There are many things still going on. The process, the research is going on, and many things we are still under the way regarding the management plan, regarding the preventions, the vaccines, and their pathogenesis. But still, the what available information is there. I will try my best to present in this webinar. So, monkeypox basically, as you know, this is a disease just similar to the smallpox. And it is caused by a virus, which is an orthopox virus. And this orthopox virus is basically a virus which also causes smallpox. And this orthopox virus has got variola virus, which subtype, which causes smallpox, a vaccinia virus, which was used in making a smallpox vaccine, and molluscu virus that causes molluscum contagiosum. This is a skin disease which is sexually transmitted and causes lesions in the skin, especially in the homosexuals and all these. So this virus, monkeypox virus, belongs from the orthopox virus family. So that is the reason the similarity of the disease monkeypox has got very much similarity to the smallpox. Now, this disease is a zoonotic disease. That is, the disease is transmitted from this virus is transmitted from the animals to the humans. And it has been detected in squirrels, in prairie dogs, and which has been, and the reason was this, the first case of this monkeypox was discovered in 1958 in Copenhagen, Denmark, when there was a research going on the monkeys, some of the colonies of monkeys, and they found a disease in those monkeys, which was just similar to the smallpox, and hence the name was given monkeypox. But the first human case was discovered in 1970 in Congo during the period of intensified effort to eliminate the smallpox. You know, there was a vaccine against the smallpox, and the WHO, the entire world, they were trying to eliminate this disease from the world. So the vaccine, which was very successful in eliminating the disease, and it was in 1980 that this smallpox was eradicated globally. And after that, the vaccine, which was used to be given for the smallpox, that's what discontinued. Now, regarding the situation update, regarding the monkeypox still update, there are about more than 87,000 confirmed cases of monkeypox globally. And out of these, 141, they are deaths. And about 111 countries, they are involved in this, having the patient of this disease. And the majority of the cases, you can see from this figure, that the majority of the cases, they are reported in the America. And then is the European regions and other African and all these other countries of the world. So there have been thousands of the people now has been affected by the monkeypox. So initially, as I mentioned, that the disease was limited only to the Africa, which was Central Africa and Western Africa. And after 2000 and 2003, the disease started spreading into other parts of the world. And in May 2022, last year, so there were many confirmed cases of monkeypox, and that's the region that has been declared as a evolving threat of modern public health. And WHO announced this monkeypox outbreak as a public health emergency. Similarly, CDC also declared it as a public health emergency in 2022. The confirmed cases of monkeypox in Pakistan till date, there have been 5 confirmed cases of monkeypox. The first case was reported in about 25th of April 2023. A person came from Saudi Arabia and he presented with the similar to smallpox. He was then hospitalized in PIMS in infectious disease ward and later on confirmed to have monkeypox. The second case, who was also traveling with him, that who also came from Saudi Arabia, that also reported to having monkeypox confirmed. And the third case, which was reported in Karachi, he was also came from Saudi Arabia, Jeddah. He was a taxi driver there, and he presented with the features of monkeypox like rash and fever and all these things. And they then confirmed in JPMC laboratory that this patient is also suffering from the monkeypox. So there was a lady also that also came from, she also came from Saudi Arabia. And the fifth case, which is recently reported, that person, he was basically employed in, he's a Pakistani from Faisalabad. That person, he was basically employed in Kuwait Army. And from Kuwait, on vacations, he went to Saudi Arabia for Umrah. And after coming back to from Umrah to Islamabad, they report he landed with the symptoms similar to that, a rash and all these things, which the features similar to that of monkeypox. So he was hospitalized in PIMS isolation ward, and later on he also confirmed to having monkeypox. So these are the 5 cases which has been reported up to date regarding the monkeypox. But the thing which is mentioned, which is I would like to emphasize on this thing, that none of the cases has been reported from person to person here in monkeypox. So all the cases which has been reported till date, they have traveled from the Middle East, Saudi Arabia, and all other countries of the Middle East. So last year, one thing I would like to mention here, last year in 2022, there was a much fear about the monkeypox cases, that there are cases that are very much increased in country, like in our country, Pakistan. But the health officials, they had to declare a news and they had to issue an alert that last year there were no cases of monkeypox in our country. It is this year in April 25 when the first case of monkeypox was reported. So up till now, there are only 5 cases in Pakistan which was reported to have confirmed monkeypox. So regarding the transmission of monkeypox, it is transmitted basically from the transmitted to the humans through the contact of infected animals. And animals, there are squirrels, rats, primates, and the monkeys. And these animals, the people who are living on the areas where the animals are there, infected animals, or the person who are keeping as pets, or the person traveling from those areas, they are the main source of spreading the disease. The person-to-person transmission of monkeypox can occur through the direct contact with the infectious skin or through the lesions in the mouth or in the genitals. And the spread of the disease can occur face-to-face, like talking or breathing, skin-to-skin by touching and vaginal anal sex, mouth-to-mouth like kissing, mouth-to-skin contact, respiratory droplets, or short-range aerosols from the prolonged close contact. Now, the thing which is regarding this respiratory droplets, it has been assumed that probably this disease, monkeypox, as it is spread through the respiratory secretions, so probably this disease is going to spread in a similar way as COVID-19. But till now, the research which has been going on, it has been found that the spread of this disease is not so much as the respiratory droplet infection of the COVID-19. So a person-to-person transmission of these respiratory secretions or respiratory droplets, there have to be a prolonged contact with the person who is suffering from monkeypox. So anyhow, still the emphasis of these PPIs and all these things, PPEs, personal protection equipments and masks is still there. We will discuss later in the management. So the respiratory secretions, the respiratory droplets, they are still the source of transmission of this monkeypox. The virus, it enters into the human body through the broken skin, through the mucosal surfaces, like pharyngeal, ocular, genital, and anorectal, or via the respiratory tract. And people with the multiple sex partners, they are at the most risk of monkeypox. And because of these communities, especially the homosexuals and the male homosexuals, and that's the reason the cases is much reported in USA. The animal to human transmission of monkeypox occurs from the infected animals to the humans by biting or scratching, or during the activities the person who are involved in hunting or skinning or cooking. So they are at high risk of having this monkeypox. The people can contract monkeypox from the contaminated objects such as clothing or linen, through the sharp injuries in the healthcare or in the community settings like tattoo and parlors. So not only the close contact, but even the surfaces, the contaminated objects, they can spread the disease. Now, there's a question here that has Saudi Arabia been informed about all our cases coming from there? I'm exactly not sure about this thing, but I think it needs to be confirmed by the health ministry, because the cases which has been reported till now, the 5 cases, all these cases, they traveled from Saudi Arabia. So probably, I don't know, I'm not sure about this thing, but probably the health ministry must have informed the because they are reporting to the WHO, and WHO has assured Pakistan for the provision of the kits regarding the diagnosis and even the vaccines. So this figure, it just brief outline what we discussed just now, the rodents like squirrels and rats. So these squirrels and rats, they have been kept as a pet in the Europe and the USA by some of the people. And if it is infected, it is one of the mode of transmission to the virus is transmitted to the humans and monkeys. Yes, they transmit the virus to the humans. And like this, it is transmitted to the person is infected, and then he transmit the disease to the other human beings. So this is a similar slide, almost. Monkeypox virus, infected animals, the body secretions, they contact with that, scratch or bite with these rodents, and physical contact, and even the contaminated meat or objects. This is also one of the source of transmission of monkeypox to the humans. So the risk factors, what are the risk factors and who people they can affect, they can be affected from the monkeypox. The first is the exposure to the infected animals, as we just discussed, that the person who are living in those areas where these animals are, persons who are involved in the hunting and all these processes in those areas, a person who is keeping pets. And suppose, for example, as I told you that in 2003, there were prairie dogs, which is type of squirrel, which was imported from Ghana to USA as pets. They were the source of disease in 2003. So in 2003, the first case outside the Africa was reported in USA. And later on, those prairie dogs, which was imported from Ghana to USA to keep the pets for those people, and about 81 cases, confirmed cases, they were reported in 2003. And at that time, that it created an alert that this disease is really a similar disease which is spreading to the people, and it has a similarity to that of smallpox. Close contact with someone infected with monkeypox, yes. A person who is suffering from monkeypox, the close contact, the loved ones, the person who is taking care of that person, they are more at risk of suffering from monkeypox. Lack of immunity, individuals not vaccinated against smallpox. Now, this is very important. You know, till 1980, when WHO declared smallpox that it has been globally eradicated from the world, the smallpox vaccine was discontinued. It was not given anymore to the people. Now, those who received the vaccination against the smallpox, they has the protection for the monkeypox. The reason being because monkeypox and smallpox, they both of them, they belong from the same virus family, orthopox virus family, and the person who had received the vaccine against the smallpox had a protection for the monkeypox as well. And those children born after 1980s, they were found to have more cases of monkeypox. And that is the reason. And after 1980s, the children which were born in Africa especially, they were found, much of the children, they were suffering from the disease monkeypox. So the immunity has been provided to those individuals who had vaccination against the smallpox. Now, travel to areas where monkeypox is endemic, they are also at increased risk. Similarly, immunocompromised patients, especially the HIV patients, patients undergoing chemotherapy, they are a high risk of having severe form of monkeypox. Regarding the pathophysiology of this monkeypox virus, basically the monkeypox virus is a DNA virus. It contains a double-stranded DNA, and it's a large virus, brick-shaped virus. And this virus, it enters into the human body from the, as we see, through the respiratory droplets, contact surfaces, or mucocutaneous lesions. When it enters into the human body, it replicates in the human body, and it stimulates the CD8 cells of the immune system, as a result of which there is activation of interleukins and activation of interferons, and these then stop the replication of these virus. And similarly, once the virus enters into the body, it goes from the oral pharyngeal mucosa or respiratory mucosa. It circulates to the lymph nodes, draining that area and leading to primary viremia. After the primary viremia, the lymph organs, they are involved, including the spleen, and viral replication occurs there, leading to secondary viremia. And secondary viremia that involves the tertiary organs, skin, leading to the clinical manifestation of monkeypox. So this is the pathophysiology briefly, what has been mentioned up till now, that how this virus enters into the body and the replication of virus, it occurs. So this is the same reputation here, that the virus after exposure, the virus enters into the human system and into the lymphoid system, the primary viremia, the organs, the regional lymph nodes, they're involved, spleen, other lymphoid organs, they're involved. This leads to secondary viremia. And then the secondary viremia, it leads to it involves the effects, the target organs like eyes, skin, liver, and brain. So this is how the virus affects the body and lead to the clinical symptoms of the disease. The incubation period of this monkeypox virus is usually from 1 to 2 weeks, but it ranges from 5 to 21 days. And that is the reason the quarantine for the diagnosed or suspected cases is for about 21 days. Now, how do this monkeypox virus is present to you? The disease, it basically, in majority of the cases, the monkeypox is mild disease. It's a self-limiting disease. It recovers spontaneously, and usually, in most of the cases, no specific treatment is required. But it can present just like a flu-like illness, as other viral illnesses. This monkeypox, myalgia, headache, and the specific thing for this monkeypox virus is the skin rash. Now we're going to discuss skin rash, and lymphadenopathy is associated with this thing. In severe cases, the monkeypox can cause complications like secondary bacterial infection, it can lead to sepsis. And this monkeypox, as you know, there's an incubation period for 5 to 21 days. After that, 1 to 3 days, there's a prodromal phase, and then the rash appears after the prodromal phase. The rash appears about 1 to 3 or 4 days, and the rash, it progresses from macules, papules, vesicles, and pustules. The rash, I'm just showing you I will show you in the picture now, the type of rash. It is well circumscribed rash, deep-seated with umbilication, and a painful rash. Now, sometimes it becomes very difficult to differentiate a rash of monkeypox from the rash of chickenpox. but still there are some differentiating features which can help us to differentiate a monkeypox rash from the chickenpox rash. Now, the thing which is emphasized here is the monkeypox rash has got all the stages of rash at one time. Now, I'll just show you a diagram here that the monkeypox rash, it starts as a macule, which is a circumscribed area on the skin. Then it for 1 to 2 days, this persists. Then it persists to papule, which is a raised area on the skin. And then it progresses to the vesicle, which contains a clear fluid within the vesicle, within the lesion. This also persists for 1 to 2 days. And this vesicle then progresses to the pustule. Now, pustule, it contains radiopaque or pus-like fluid. And then this pustule, it progresses to crusting occurs, and then the scab formation. So this entire process from the macule, papule, vesicle, pustules, and scab formation, this takes about 2 to 4 weeks. Now, in case of monkeypox, if you see a cases of monkeypox, they has got all these stages, they're present at a time. For example, if the patient has got macule, the entire body will be having a macule on the entire body. And this macule will be then transformed to the papule. So the entire body will be having papule, or the entire body will be having a vesicle, or the entire body will be having a pustule. So a single stage will be present on the entire body. While in case of chickenpox, what you see that the different stages of this rash is present at the same time. So there may be a macule, there may be a pustules, there may be a vesicle, there may be a crusting present at the same time. But in this monkeypox, it is not like this. If there's a macule, the entire body will contain macule. If it's a pustule, the entire body will contain pustule. And I will repeat that in chickenpox, all the stages of the rash, they are present at the same time. So this is the important differentiating feature. And secondly, the monkeypox rash is very painful. It's a painful rash. While the chickenpox rash is not painful, it is itchy. It is very itchy. And these two are very important differentiating point about the rash. Now, the monkeypox rash, it basically starts from the face, spread to the arms, to the limbs, lower legs, to the hands and palms and the soles. This is how it's spread like this. Now, these are the few pictures regarding the rash. You can see here, this is the rash, which is a pustule, contains a pus-like fluid. This is a rash, which is a vesicle. Now, this is also a rash, which is a pustule. Now, you can see that all stages of pustules, they are present. Now, in this photograph, you can see that this is all crusting. So this is the recovery stage of the rash. All the crust, they are present there. So this is how what I want to tell you, that in case of this monkeypox, the one stage of rash is present at a time. Not all these stages of rash, they're present in a single time, like in case of chickenpox. Now here you can see, these are the vesicles. This is a vesicle. This is a pustule, this one. This is also a pustule. Now, these are also some of the pictures of monkeypox rash. These are the pustules which can be seen. This you can see on the hand. This is the crusting stage on the palms. And this is also the crusting stage of the rash. So a rash starting from the macule to the crust, it takes about 2 to 4 weeks. So these are all the vesicles containing clear fluid. These are also vesicles containing clear fluid on the palms. So what are the complications of this monkeypox? So yes, there are complications. There is a viral illness. It can lead to bronchopneumonia. It can lead to respiratory distress syndrome, encephalitis, septicemia. Infection of the cornea, this is very important because it can lead to corneal scarring and can lead to the visual loss. Myocarditis and proctitis can occur, especially in the homosexual males. Differential diagnosis of monkeypox. So once we have discussed in chickenpox, there's some differentiating features we have already discussed. Measles, yes, the rash of measles also present like this. Herpes simplex, impetigo, syphilis, drug eruption. But a healthcare professional, he can diagnose this monkeypox from the clinical presentation, laboratory testing, and this can help us to differentiate between a monkeypox rash from the other rashes. So how you diagnose monkeypox? So important thing in the diagnosis is the history. So any history of travel from the endemic area, any history of close contact with the person who suffered from the monkeypox, or there is any history if the patient has in contact with the infected animal, that can be also cause the monkeypox. So this is history is very important. And secondly, on examination, the rash, which I told you, a single stage of rash, it could be of macular or vesicles or pustules, and that can be accompanied by fever, is a hallmark of monkeypox. And the lymphadenopathy is also associated feature of monkeypox, and this can support the clinical diagnosis of monkeypox. So depending upon the history and clinical examination, we can make a high index of suspicion if we suspect that the patient has got monkeypox or not. The diagnostic test for the monkeypox is basically a PCR. WHO, CDC, FDA, all of them recommended PCR as a diagnostic test for the monkeypox. It detects the viral DNA, and the specimen is usually taken, a swab is taken from the skin rash, from the fluid, or from the crust, or from the vesicles. And if suppose the patient doesn't have so much rash, or there is no rash, and you still suspect that the patient is suffering from monkeypox because of traveling in endemic areas or in close contact with person, then we can proceed for a swab which can be taken from the oropharyngeal mucosa, from the rectal swab, or from the vaginal swabs. They can be taken and a diagnosis can be made. Now, testing of blood has not been recommended. Now, one thing which I would like to mention here, that the rapid diagnostic kits, they are available. Like in case of COVID-19, rapid antigen test kits were available. Similarly, for the monkeypox, many countries, they have developed rapid diagnostic kits. They can detect the antibodies, and they can even detect the antigens if suppose a swab is taken from the lesion. Now, the rapid diagnostic test can develop the antigens present in that and make a diagnosis of monkeypox. Similarly, a blood sample can be taken, which can make a quick diagnosis of monkeypox. And these rapid diagnostic kits, they are just immunochromatographic devices, and they give the result within about 15 minutes to 30 minutes. But still now, WHO, CDC, FDA has not approved these kits. And the reason being, what has been told up till now, that the different types of orthopox virus, because it is not able to differentiate that the test which is positive is because of monkeypox, or the patient has been vaccinated previously for the smallpox. So a person who has received vaccination for the smallpox can have this test positive. So still the research is going on, and CDC and WHO has the devices, they're available they has been manufactured from the China, from the Europe, even our neighboring country, India has made the device of the rapid antigen kits. So, but this has been made and the process is going on. Probably if the number of cases are increasing with passage of time, probably the WHO maybe then allowing these devices to be available in the market. But till now, the confirmatory test is the PCR. So regarding the treatment of monkeypox, now our main goal of treatment of monkeypox is to take care of the rash, because it's a very itchy rash. and to manage the pain if there's there, and to prevent the complications. So there is no specific antiviral treatment available till yet for the monkeypox. There's one medicine I'm going to just discuss in the next slide. Only supportive measure which has been advised for the management or treatment of monkeypox, and these include the symptomatic relief of the pain, antihistamines because the rash is very itchy, and antibiotics if there is superadded infection. That can be covered with the antibiotics. There is an antiviral with the name of tacoviramat. Now, this tacoviramat, basically, it was recommended for the patients who have been diagnosed as a case of smallpox. So this tacoviramat basically was for the treatment of smallpox. But now the CDC has recommended, even the European countries has recommended this medicine, tacoviramat, for the treatment of monkeypox as well. Because as you know, there is smallpox and the monkeypox, they belongs from the same family, orthopox family. So it has been recommended, but the recommendation is that this medicine should only be used for the severe cases, or those who are immunocompromised, or those pregnant ladies suffering from monkeypox. They can be given this medicine. There's other two medicines, they're still under trial, which is benzidofovir and cidofovir. But as I told you, the supportive measures, including advocate hydration, adjuvant therapies like skin protection, calamine lotion, and petroleum jellies, they can be advised for the management of skin. Proctitis, yes, this is very painful for the patients who are suffering from this. So lignocaine jelly, that can be advised, anti-inflammatory agents locally. Perineal lesions like sitz bath, systemic analgesics, opiates, and we can take the assistance from the dermatologist as well regarding the skin lesions. How we can prevent the monkeypox? So the pre-exposure prevention, the vaccines, and the infection with orthopox or immunization with orthopox vaccine provides immunological cross protection against the other viruses in the same family. So that is the reason this Genius vaccine, which has been licensed in US for the prevention of smallpox, has been now licensed in 2019 for the prevention of monkeypox as well. So basically this vaccine was discovered for the smallpox, but now it has been recommended for the patients, for those for the pre-exposure persons for the monkeypox as well. So there are two doses administered subcutaneously, 1 month apart. And but in our country, the health ministry has requested WHO for the provision of vaccine. But what I have searched till now, the vaccine has not been available in Pakistan till yet. So the special consideration of this vaccine is that if the patient has got post-exposure prophylaxis, if he needs a person who has a close contact, who is in a close contact with person suffering from monkeypox, then he should have vaccine ideally within 4 days. So there is insufficient data about this vaccination in immunocompromised or in pregnant ladies. Now, there are many outstanding questions regarding this vaccine, and which need to be answered, that how effective are these vaccines against the monkeypox? Because initially, as I told you, this vaccine was made for the smallpox. It has been recommended now for the monkeypox as well, but how effective? How durable is the immunity they confer? Will the booster dose needed or not? And what are the correlates of protection? And what is the impact of different dosing strategies and routes of administration on efficacy? What is the impact of vaccination on post-exposure prophylaxis? And what about the response of vaccine in special groups like pregnancy, in pediatric age group? Because this Genius vaccine has been recommended by the FDA for the children 18 years and above. It has not been recommended for 18 years and below. So what about the pediatric age group and immunocompromised individuals? So these are the few questions which need to be answered, and probably with the passage of time, we will have answer regarding these questions. So the other measures of protection from the monkeypox virus is the isolate the infected patient, avoid contact with animals that harbor the virus, personal protection equipments, so use of mask and all these things, especially the healthcare professionals who are involved in the management of these patients. Avoid direct contact with any materials such as bedding, linen, laundry that has been in contact with the sick patient. So these are the same general guidelines: hand hygiene, personal protection equipments, environmental cleaning, and we have to be careful in patient transport. Now, WHO has basically made a warning regarding this monkeypox, as the outbreak of monkeypox is increasing day by day globally. So the warning is basically for those people who loved ones or have been affected. And because the cases has been identified in communities of gays, bisexuals, homosexuals, especially males having sex with the males, and in country like USA. So that's the reason it has been much of the information has been given to these people, these communities, that they should be careful about the monkeypox virus, and they should learn and know about the information about the monkeypox virus in order to prevent the further outbreak of this virus. So there are many future directions of research. Just as a very congested slide, but just want to show that vaccine, there are many things going on regarding the vaccine development, antiviral therapies, pathogenesis and immunology, epidemiology, and surveillance. So in summary, the monkeypox virus basically is a viral disease which is caused by a monkeypox virus, which belongs to an orthopox family. And there are two different clades which exist, clade 1 and clade 2. And the common symptoms of monkeypox, they are skin rash or mucosal lesions that can last for about 2 to 4 weeks. And this is accompanied by fever, headache, muscle ache, back pain, and lymphadenopathy and low energy. Monkeypox is transmitted to humans through the physical contact with someone who has the disease, contaminated material, or even from the infected animals. The laboratory confirmation of monkeypox is done by testing the skin lesion material through the PCR, real-time PCR, and monkeypox is treated with supportive care. Vaccines and therapeutic which have been developed for the smallpox, like tacoviramat, which I told you, medicine has been approved for use in some countries, can be used for the treatment of monkeypox. Monkeypox can be prevented by avoiding physical contact with someone who has monkeypox, and this can also help in prevent the infection for people at risk. Ongoing research is focused on vaccine development, antiviral therapies, pathogenesis, immunology, epidemiology, and surveillance. So there's a lot of research going on. So many information which is still deficient need to be clear in the coming days. So the monkeypox is expected to spread much more worse than seen today, though not like COVID-19. So we need to learn the disease and tackle it with, and the role of sanitizers and personal protection equipment still continues. There is no specific treatment of monkeypox. The antivirals, they are available, but the still research is going on that which antiviral it more suits for the treatment of monkeypox. Smallpox vaccine, Genius vaccine, is used for therapeutic and preventive purpose. So thank you very much.
Thank you very much, Professor Saab. Thank you very much. Very nice presentation and very beautiful information. It is very interesting point today that exactly on the same day, 28th date, on this forum, we presented the same lectures, the prevention and about the information about the monkeypox. 28th May last year, 22 was our 30th webinar, and today it is 72th webinar. Anyhow, let's analyze us what we have learned from these informations that we are providing. And lastly, we were here, the Pakistan, we were the first to present these things, the information about and the danger, the prevention of monkeypox. Thank you very much. There are so many hands raised. Anyhow, the first one is Professor Rashid Saab. Professor Rashid Saab is a professor of physiology and is a general practitioner. Professor Rashid Saab.
Welcome.
Thank you very much. Excellent presentation by Dr. Javed. Dr. Javed, they are the general practitioners, and the cases first to come to us. They go to hospitals when they are already complicated. Our issue is diagnosis. Is there any blood test available in KP in your knowledge in Khyber Medical University or any hospital? Because we cannot refer every patient to NIH Islamabad. Please comment on that. Hello?
The Ministry of Health, the Ministry of Health voted all the. Can you hear me? Sir, can you
Yes,
hear me?
yes,
Okay, so the federal ministry has reported to has advised all the provisional ministries of health that any case which is suspected to suffer from monkeypox, that should be immediately reported to the concerned district health authorities. If, sir, if you suspect a patient, if a general practitioner suspect a patient suffering from monkeypox, the first thing he should report to the district health officer that there is a team for this infectious disease, especially the government has constituted the teams for this. They are going to collect the sample and they are going to send the sample to the NIH Islamabad. It is their responsibility to send the sample, and it's free of cost. And then if you suspect the patient need to be isolated as well. So this is how it goes on. But in KP, as far as I know, there is no such laboratory which makes the diagnosis of monkeypox.
Yes, Dr. Rashid, basically in Pakistan, there are very limited laboratories who are confirming the monkeypox. You know, last year we wrote the letter to the WHO and the WHO entertained our letter that changed the name of this disease. So we are happy that the name has now been changed to decrease the discrimination between the different clades. The thing is that there is only one lab in Pakistan, that is in Islamabad, who is going to confirm it. Anyhow, Professor Javed Sarwar's presentation was very, very useful, that first of all, you differentiate clinically and make the difference clinically, because the immediate differential diagnosis is the chickenpox. And the chickenpox is, we are observing the same parallel occurring and confusing the monkeypox and this disease. Another thing is very history of this disease is much, mainly we observed the previous cases were in male and they were homosexuals. Anyhow, the things are now changing, but I think the presentation, the summary of the Professor Javed Sarwar is beautiful, that we should make difference and differential diagnosis on the basis of the our clinical observation. And now it is the duty of our authorities that we should work together to submit this sample to the NIH, that is which is the free now. Dr. Khushik Bharat. Dr. Khushik Bharat, you want to raise the question? I have asked the question.
Yeah. First of all, I would like to congratulate Professor Sarwar for this fantastic talk.
Thank you.
I have two quick questions. One is that WHO withdrew the public health emergency of international concern earlier this month, if I remember correctly. So you also mentioned that in the future, there is a chance of severity of Mpox. So is there a chance, or what is the likelihood of a resurgence in the light of the withdrawal of the PHEIC of this Mpox? Is there any chance? That's one question. Second one is the occurrence of Mpox during the COVID-19 pandemic. Is that just a coincidence, or is it due to other factor, like you mentioned, that in immunocompromised patients such as HIV/AIDS patients, so they are the vulnerable group, and they're the vulnerable group for COVID-19 also. So could this be a reason? So these are the two questions.
Actually, the mode of transmission of both the COVID-19 and this Mpox is totally different. So Mpox, as you know, this was transmitted from the animals to the humans, and then from the humans to humans by close contact and all these things. So this is the basic reason for the transmission of this disease. I think this is could be a coincidence, but the etiology and mode of transmission of Mpox is totally different from that of COVID-19. But the protective measures, they are almost seems to be similar, because it was, as had been discussed, that is a droplet infection. Although there is a much debate going on still regarding this droplet infection, that whether this is a droplet infection like COVID-19 is going to create spread of the disease similar like COVID-19. But many things, they are still under process. But till now, what we have seen that it is not spreading as such like COVID-19. The spread of the disease is basically in contact with the skin lesions or in the homosexuals and the people having close contact with the person infected.
Close contact.
Yeah, this is the main basic reason for this thing.
Yes, Dr. Bharat, actually, basically two different diseases with two different etiologies. But we cannot say that this is due to an immunocompromised or other people's, because we are, Dr. Javed Sarwar in Pakistan, we have seen the peoples who are young, and I think there is no anything we can find about the immunocompromised element there. There's definitely two different diseases should be diagnosed, managed differently.
Thank you.
Professor, anybody else want to raise the question? Dr. Umar, Professor Umar, can you comment few things? Professor Umar?
Ji Janab. Dr. Mulazim, yes, I'm here.
Yes.
It was a wonderful talk, and it was really thought-provoking for us, Professor Javed Sarwar. And I think you will share this presentation for PPS website as well, so that
Sure.
And if allowed by Professor Salma and Professor Mulazim, that if we can have this for our students as well for final,
Definitely.
is it possible?
Definitely.
Of course, you're most welcome.
You're more welcome.
Thank you. Just a small suggestion.
Kaisar Sajjad, can you give some comments? Kaisar Sajjad? Dr. Kaisar Sajjad?
Yes, Mulazim sir, thank you very much. Actually, I'm sorry, I have just joined. I missed all major part of the Dr. Javed Sarwar's presentation, but anyhow,
Really,
I
it
think
was a beautiful presentation.
it was very excellent presentation, and the topic was, Mulazim sir, was very important from the today's issues point of view. So I think the monkeypox, as compared to the coronavirus, it's not so serious, but it can be taken as a preventive measures, and there is no need to afraid or create or havoc or any panic. So the prevention is very good, and public should be aware of the monkeypox. This is the only aim should be there, and everybody knows that the PMA is always working for the prevention is better than cure. So I think Dr. Javed sir has done a wonderful presentation and spare the very valuable his time, family time rather I can say, and I can thank you to all the participants. They have joined this today's webinar. Thank you very much, Mulazim Saab. You have been doing a fantastic work to provide awareness on the platform of the Pakistan Medical
This is
Association.
with cooperation of Professor Salma Kundi and you.
Thank you very much, and credit goes to you, Mulazim Saab. God bless you. Thank you very much.
Professor Salma Kundi, over to you to conclude today's session and give the vote of thanks.
I'm very, very grateful to Professor Javed Sarwar Saab, and on behalf of the Pakistan Medical Association, the Pakistan Physiological Society, Pakistan Association of Pathologists, the South Asian Association of Physiologists. I thank everyone, and on behalf of Women Medical and Dental College and on behalf of Educate Medical College. But the vote of thanks should be given by Professor, if I may request you to, by Professor Dr. Kassar Saab, Sajjad Kassar Saab, because he is the backbone of PMA, and I would really like it if he gives the vote of thanks. Thank you.
Thank
Dr.
you so much.
Kassar.
I think Dr. Salma Kundi जो है वो बड़े से वो कह रही हैं मतलब everything has been done. I mean this webinar is being regularly it's every Sunday it's regularly organized by these two people. I think the man behind is Mulazim Saab, and the provocation is being done by the प्रोफेसर सलमा कुंडी. इनके बगैर तो हो ही नहीं सकता था. सलमा कुंडी ने जिस तरह से इसको चलाने की कोशिश की है, और आई होप के ये दोनों मिलकर बहुत आगे चलता रहेगा ये वेबिनार.
और इसी वजह से आज हम 72 तक पहुंचे हैं.
72 तक पहुंचे. और
पिछले साल को अगर देखूं डॉक्टर कैसर, तो एक साल के अंदर हमारे कितने हुए हैं? पिछले साल में इसी डेट को देख रहा था, वो 30वां था. आप देखें एक साल के अंदर हम 30 से ऊपर यानी 42 कर चुके हैं एक साल के अंदर. तो आई थिंक क्रेडिट नहीं है, आई थिंक ये आपकी हम सबकी एक जिम्मेदारी है जो हम निभा रहे हैं. और इससे मैं कहीं बैठता हूँ ना तो वो लोग कहते हैं कि आपके वेबिनार से हमने बहुत कुछ सीखा. और थैंक यू वेरी मच. इंशाल्लाह वी विल सी यू नेक्स्ट टाइम इंशाल्लाह. God bless. Thank you. And God bless Pakistan and all the population of Pakistan and all over the world. Allah Taala in कार्यों से महफूज रखे.
Thank you, madam.
Dr. Javed का खास शुक्रिया.
Thank you very much, madam. It's my pleasure.
शुक्रिया प्रोफेसर जावेद सरवर साहब, बहुत शुक्रिया. अस्सलाम वालेकुम.
Thank you very much, sir. Thank you.
Thank you. खुदा हाफिज.
Allah Hafiz.